Yo, what's up, everybody? Thank you guys for tuning in. We truly appreciate your time and attention. Welcome to the Men's Health Community Connections podcast. It is presented to you by Advocate Aurora Health.
I'm your host, Chad C. Roper. I have my co-host, Mario J. Brown. Health is an issue that is really plaguing the communities of color, and we just want to take the time today to make sure that we have the opportunity to speak with you guys and give you some enlightenment on some of the things that that really have a stronghold on our community.
Yes, sir. Yes, sir. So my co-host and I, as male leaders, of color, we understand and are now taking the responsibility of helping educate on men's health using the platforms 20 plus years in the music entertainment industry.
We recognize our platforms and influence is important, and we wanted to partner with Advocate Aurora healthcare professionals to basically shine some light on some of these issues in our community.
Yes, sir. So you're going to enjoy today's podcast. We have a very special guest. Joining us today is none other than Dr. Gordon. Dr. Gordon, thank you for joining us. We appreciate your time. Please just start out by telling us who you are and how you serve in the medical field.
All right. So, like you said, I'm Melanie Gordon, and I'm an internal medicine physician at Advocate Christ Medical Center in Chicago, or at Oak Lawn, Illinois. I am an associate professor of clinical medicine at the University of Illinois at Chicago, and I'm also on faculty for the internal medicine residency program, which just means that I train doctors to be doctors, and then I work in the inpatient and outpatient setting, and of course, work with the community.
Wow, awesome.
Well, that's beautiful, Dr. Gordon. First of all, we want to say thank you for taking the time out. We know that you could be saving some lives right now, but right now you chose to save some lives virtually. So we want to jump right in and discuss the topic that really plagues our community, which is diabetes. Can you actually tell us what that disease is first? Let's break down the disease, and then we want to break down what it does to the body.
Gotcha. So diabetes is pretty much a long-term illness. And to understand how it affects the body, let's understand how the body works first, right? So when we take in food, our food is converted into sugar or glucose. And then that sugar or glucose is used as energy. And we need energy in order for our organs to function. So when the blood sugar is released or converted from the food, it triggers the pancreas to release insulin. Everybody has insulin in their body, and that insulin serves as a key. The key opens the body cells to allow the blood to release that sugar and to go into the door of the cells. And then that allows our body's organs to function. It lets our hearts pump, it lets our lungs breathe, all that good stuff. So what happens in diabetes is either the body is not producing enough insulin or the insulin's not working properly. And then that leads to an increased sugar in the bloodstream, and that causes damage to our organs over time.
Got you. Now, Dr. Gordon, I like the way you broke that down in layman's terms for everyone. Now, let's talk about, I know statistically, the African American and communities of color have a higher rate of that disease.
Yes.
What do you think that is attributed? What causes that, do you think?
So I think a couple of things lead to it. When we think about preventable reasons of why we don't need to have diabetes, the big thing is what we eat and the activity that we do. And of course, overweight and obesity. So the type of foods that we take into our system leads to being overweight, and that increases the risk for us having or developing diabetes, especially within our communities. Lots of reasons for that. It could be because of food deserts. It could be because of lack of activity. People don't want to go outside and walk in their neighborhoods.
Right.
But whatever the reason might be, it leads to us being less active and not eating the right foods.
Yeah. So what do we do? What do you suggest we do about, we like our foods the way we like our foods. We become accustomed to the taste. And so how do you suggest that we, still eat good and feel good about what we're eating and remain healthy?
That's gonna be tough, because a lot of us gonna have to give up things that we don't necessarily like. And not necessarily give it up, but at least tweak it. I'm not gonna say give it up, but I'm definitely gonna say try to tweak it, because a lot of the things that we take in just isn't healthy. When we think about processed foods, it can lead to us being overweight. And we have to start leaning more towards foods that don't have a lot of carbs in it, a lot of carbohydrates. And this is the big thing with diabetes. When people think about diabetes, they say sugar. And they're like, oh, I don't eat candy. I don't eat cake. I don't eat, cupcakes. That's not my thing. But when we talk about carbohydrates, we're talking about pasta. We're talking about rice. We're talking about potatoes. We're talking about that good old cornbread that we have. Some of that stuff will be converted into sugar and can increase the risk of us having problems too. So we really got to think about food and how it's acting in our bodies, and making those adjustments can help, and little changes. So let's say you like some chicken. Well, instead of using, vegetable oil, can you use olive oil, right? So you can still have your chicken, but maybe just making a little bit of tweaks to how you make it might make you just a little bit healthier.
Now, when you spoke about sugars, let's talk about the difference of sugars, natural sugars and processed sugars. So if I eat fruits, for example, I'm getting natural sugars out of a banana, out of an orange, or so on and so forth, as opposed to eating cookies and donuts. Can you give us the difference of how the body breaks down a natural sugar as opposed to a processed sugar?
Yeah. So this is the deal. When the body is breaking down those sugars, of course, nobody ever got, overweight or got messed up by eating apples, right? You don't get overweight by eating a whole bunch of apples. But the way that the body breaks it down, it still breaks it down to sugar, glucose, and energy. Now, the thing is even when you have diabetes, let's say you have diabetes, you still have to be a little bit cautious at how much fruit you take in, because that sugar is still circulating in the bloodstream. And the thing is, it's not about the sugar that's in the bloodstream, it's how that energy gets into the cells. If it doesn't get into the cells, it doesn't get broken down. So you can take in fruits or you can take in sweets. If it gets broken down and that sugar is not moved appropriately, then you're going to have a problem either way. You got to be careful.
Yeah. Now, what would you say are the signs of diabetes? How would one know that we're on the early stages of diabetes? And also, at what point has it gone too far?
Yeah. So there's a couple of symptoms that you can look for. A lot of times people, diabetes happens over time. So one of the things that you want to look for, are you going to the bathroom frequently? So sometimes if you run into the bathroom every 5 minutes and you didn't used to do that, that could be a sign or a symptom that something's going on. Another thing, you drinking a lot of water, like you always thirsty. Nothing seems to quench your thirst. People always just drinking and juggling water or juice, something, right? Because they never get satisfied. And that's an indication that, there's a lot of sugar that's causing you to be dehydrated. You could be extremely tired. Another big one is numbness and tingling in your fingers or your toes. So you always feel like your hand falling asleep or your leg falling asleep, or pins and needles. Those can be signs of, that something could be going on, or that you could have some diabetes. Other things that you might think about, being tired all the time. And then for our guys, one of the big things is you can have issues. You can have some erectile dysfunction. So when the sugar gets too high and it starts to affect the nerves and the blood vessels, and you can't perform like you used to, then you might want to go get it checked out, not just to get Viagra, but actually to get screened for diabetes, because it could be a problem too. So those are some signs and symptoms that we look for, and that could suggest that you could have some diabetes.
Oh yeah, that's key information.
That's great. That's great information right there. Let me ask you this: when you initially got into let's go here first. What are some? Because I want to dive into the actual disease, but now I want to speak into why you got into what you decided to get into as far as a doctor. But what are some of the medications that you take for that, and then how do they? I guess I don't want to say reverse it, but help the disease.
Okay. So a couple of things. Medications that you can take could be either a pill or it can be, injections. So some of the pills that you can take, metformin, glipizide, there's a lot of medications out there that can actually help. And then the injections are different types of insulin. So if your body is not making enough insulin, or if your body is making insulin that just doesn't work properly, then you got to start taking insulin from the outside in order for it to pull that sugar into the cells. So those are the two big types of medications that you can take right now in order to help the sugar. Now, once again, when we talk about the causes of diabetes in the body, one is your pancreas gives out. It doesn't want to make insulin anymore. So after a while, if you got so much sugar and it's just running, trying to, release insulin, at some point in time, it's like, I can't do this no more, right? And so it stops producing insulin altogether. And if it stops producing the insulin, everybody needs insulin to survive. And so at that point in time, you got to start taking insulin injections, because now you're trying to get replace the pancreas. And then the other thing is sometimes your body, it's making the insulin, but the insulin is not working correctly. And in that sense, the key won't open the door. So those pills are now making it a lot easier for the insulin to get in. So the pills work to make the cells responsive to the insulin. And then if your body doesn't produce insulin at all, the insulin is what you need in order to help you, maintain your sugar levels.
Yeah, yeah. I got a quick question for you. Is it possible to develop diabetes just from it being hereditary? For example, my father has diabetes. And so that's something, of course, that I'm aware of and I look out for. And I try to eat right and those things. But is it possible to get it even though you're eating right just because it's passed down to you?
One of the risk factors is family history. So when we talk about family history, we're talking about mama, we're talking about daddy, we're talking about sister, brother. So a first degree relative. If one of your relatives have diabetes, then it does increase the risk that you can develop diabetes later, and it does need to be on your radar. Now, can you prevent yourself from becoming diabetic? Yes, there's things that you can do as long as you're aware. But having a family history does increase the risk that you can develop diabetes, even if you're not overweight, even if you don't have any of the other issues. That genetic component is strong.
Yeah, that's good. That's good.
Yeah, that makes sense. Now let's talk about let's go into Dr. Melanie Gordon. When you were coming up, what made you decide to even go into this field? Because going into medicine is extremely tough field. I have a lot of friends that are doctors, and I'm like, y'all crazy. Nowhere in the world. I'm finna go to school for 865 years and owe $275 million when I leave. Do you know what I'm saying? So what made you decide to go into that field?
It's interesting because I ain't know nobody who was a doctor when I was younger. So, my parents, nobody is doctor. I think I'm definitely the first one and the only one right now in the family that is. So I actually had role models. When I was in high school, I would do like science, over the summer science things. And those people that I talked to kind of made me think about, we can become doctors, we could do that. Right. And so I had a lot of outside sources that kind of pushed me. At UIC, they had an urban health program for high school kids that were Black and brown. And they would bring us in and they would just introduce us to different types of jobs within, science and things like that. And that's kind of where I got. Now, my parents were definitely motivated, like, oh, girl, you're going to be a doctor. Okay, do it. But when it came down to how I did it, it was definitely a lot of mentorship from outside.
That's beautiful. Wow. That's beautiful. That's huge.
Yeah.
Yeah. So we can go ahead, Mario. Oh, go ahead, Chad. So we can tell that you're very, very well educated and versed in your field. I just kind of wanted to shift gears a little bit and talk about maybe, is it a popular or unpopular topic, the vaccination? Can you tell us your thoughts on people in our community or just overall in general who are hesitant on getting the vaccination?
Yeah, so vaccine hesitation in our community. There are still a lot of people that are, for some reason, they don't want to get it. I've heard so many reasons. I've heard about, I think 5G. One time my brother was talking about the 5G and the microchips. And I'm like, are you kidding me? And a lot of people talk about how the science, it just went too fast. It came out too fast, or, I can't get it. So there is still some hesitancy. I've been trying my best to, convince folks to get this vaccine. When people talk to me about the science, they don't know the history that went behind it. This mRNA stuff, there was a woman that was working on this technology from like the 70s or the 80s, right?
Right.
I mean, and if you think about it, when you actually go back and look, she worked at Pfizer and she worked at Moderna. That's why those are the only two places that got the mRNA.
Exactly.
They're using her technology, right?
Exactly.
But don't nobody know that. And what kills me, I got people that say, well, we don't know what's inside of that vaccine and all this other stuff. Now, we have people that will come and ask for Viagra. They come ask for, they never ask me the ingredients in that stuff.
Exactly. Ever.
They never, right? They don't ask me what's in it. But when it comes to the vaccine, I mean, they're like, well, I don't know what the ingredients and it's not going to work. It's crazy. So some of the things that I try to do is when I talk to patients, I try to see what is their hesitation? What is your issue? And then I try to address them at the issue, because it's not going to be something that is going to work in a commercial. It's not going to be something that's going to work just by broadly telling folks. It's going to have to be a grassroots effort. Like they're going to have to see that you got it and that you fine, and that might convince them to go get it.
Right. Right.
Yeah.
See, to me, I totally agree. People have so many excuses why not to do something, and they say they did their research, but the research would be they talked to somebody or they was on YouTube. There's not if you really did some research, your thought process about it would be different. Because I actually did some research myself, and I saw how dRNA moves around in your body and helps basically creates the map so that your body know what to do when it sees something that's not correct, and it knows how to actually fight whatever it is and put, I understood the process, but that's because I actually wanted to research. Some people, I didn't just go on Facebook. Most people wake up and they scroll, so they got their news for the day. That's not research. So I understand 100%. Now let me ask you this: do you think? And I'm glad you made the point about how how that was created in the 70s originally, how it started in the 70s, and you notice those two companies had used that mRNA. I guess mRNA. So the fact that it's been done before, but you and if you ask those same people that say they don't know what's in it, and you ask them what's in a Tylenol, they're gonna say Tylenol.
I know.
You ask them what's in an ibuprofen, they're gonna say ibuprofen. You know what I'm saying? They didn't give you every element, you know what I'm saying, the chemical equation for those individual things. So I'm glad you said that, because that's extremely important for us to understand that anytime, you know how they use the expression, a high tide lifts all boats, right? They use that expression back in the day. But what they fail to realize is when the world has a cold, the Black and brown community has pneumonia.
Exactly.
So they have to understand that concept, and they don't get it. That's like when they were talking about trickle down economics back in the day. It trickled down everywhere, but it stopped as soon as it got to everybody, people of color. So we got to understand what the issues really are here and what's important. And to me, you can't do anything if you're not alive. Exactly. I've seen so many stories of people saying they wish they would have gotten this or wish they would have done, and then how it gets to the end and boom, they dead. So in memory of them, they were actually documenting these individuals. You know what I'm saying? And they were saying in the documentary, they would say, I advise anybody to get it. When I get through this, I'm gonna get it when I get done. Then boom, they dead. Now you could have. So to me, I'm glad that you pointed this out, because I don't whether you Democrat, Republican, white, black, transgender, whatever, the disease don't care. It kills everybody. There's no discrimination whatsoever. So that's what people fail to realize. It's people that praise God, and it's people that praise Allah. They all dying if they get in the disease. It doesn't matter. So to me, that's extremely important that you actually broke that down, so that in layman's terms, so that people can understand why it's important to not only cover themselves, but cover their families as well.
For sure.
Yeah,
for sure.
Absolutely. Yes. So I also wanted to talk to you about something else that I know as a man. We're not the most comfortable going to the doctor. It's something that we do when we absolutely have to. And so I don't know what we attribute that to, because most of us consider ourselves strong, but when it comes to the doctor and that strength is like, I don't know if I want to go that route right now. So talk to us about the importance of just routine doctor visits.
Yeah, I can't stress it enough. Just within the last month or two in the hospital, I've had at least 2 or 3 young Black men in their 30s that ended up on dialysis. Kidneys just gone. And it was because they had high blood pressure, never went and saw a doctor. And it had gotten so bad that by the time they came in, it was too late to do anything more, right? Like we could get the blood pressure controlled, but the kidneys was just shot. And it just broke my heart, because here I am telling this 36-year-old guy that he's going to have to be on dialysis 3 times a week, 4 hours each of those days. And his life is going to completely change, right? And then they start asking me about renal transplants, kidney transplants. And it's not that simple. It's like you can't just go to the store and get a kidney and then call it a day, right? It's a whole process. So it's so important, because that was completely preventable. I mean, one little pill could have stopped them from having, the blood pressure to be controlled. Same thing, heart attacks, strokes. We always see people at the most severe consequence of whatever the little thing was, right? And a preventable visit, just going to see your doctor once a year, even if just once a year, get some blood work done, get your blood pressure checked, because that can make a huge difference. a lot of times these diseases present and there's no symptoms, right?
Right.
The high blood pressure we call the silent killer, because you don't know you got it until you have a heart attack or a stroke, right? And if you go and get these things checked early, then it can just make the world of difference. Same with diabetes. It's preventable. 58%, if not more, can prevent becoming diabetic by changing their lifestyle if you get caught in that pre-diabetic phase. And the only way that you can know that is by getting your numbers checked. If you never get your numbers checked, you never have that opportunity to intervene. And then once you got it, it's kind of too late.
That's a fact. That's a fact. And I'm the person who got, like, some people, a lot of times people don't go, I know, because of insurance purposes, right?
Mm-hmm.
So, but I had insurance, and I felt like, think about it. I tell people to think about it like this. I know people who have great insurance, like executive level health coverage, and won't go to the doctor. I'm like, so you basically saying you went and bought the most expensive pair of Jordans or the best car you can ever find, and you never drove it or you never wore them. So that's like health insurance. You got the most expensive things. Some of it costs more than your house, but you never use it. I don't understand. You would not let a Rolls Royce sit in your garage and never drive it. That's health insurance. That's how we should look at it in the Black community and brown community. You know what I'm saying? So to me, it's logically, it doesn't make sense to me, because anything else we got that's of value, we take advantage of. But then you got something like that saves your life, and you won't even take advantage of it. It makes no. I'm a avid doctor and dentist goer. Like, I just do that just on GP. Like, oh, it's Thursday. Let me go to the doctor right quick. I ain't got nothing else going on.
Yeah. And I would rather have that than somebody who ain't never been, in 5 years. And then they come in and have some issues. Yeah.
I 100% agree with you. I had an earache. I went to the doctor like, hey, yo, something ain't right. You know what I'm saying? I knew they were going to give me some drops, but shoot, I mean, I got insurance. Why not go? I just don't understand. So I get it 100%. I think that's extremely important. And a lot of the illnesses that the men that we are afraid of are things that all we got to do is eat salad, change from this. Yeah, you can prevent it easily, but stubbornness, and then now it's too late. Now, and that's unfortunate to hear that about those two gentlemen.
Yeah. It's kind of jacked up. The other thing is exercise, because if you think about how food works, the food is used for energy. Yes. And energy is what we use in order for our, cells and stuff to function. So when you exercise, you need more energy. If you have a lot of sugar that's in your bloodstream, the more that you exercise, the more your body's going to require energy, and the easier it's going to be for that sugar to go into the cells, and it decreases the chances of you, getting diabetes or helping your weight and all these other issues, your blood pressure, your cardiovascular, all that stuff. So one of the big things we tell people, 150 minutes per week. That's like 30 minutes, 5 days, or, for about 50 minutes, 3 days a week or something like that. But just remaining physically active can help prevent some of this stuff.
That's extremely important. Now tell me if I'm thinking about this correctly, because there was a time during COVID when everybody was gaining weight. They were going up, and I was going the other way because I just got addicted to like a treadmill. You know what I'm saying? So, if you don't take in so many processed sugars, does your body start to burn fat? Is that how the body burns fat? Because you're not. I guess if your body doesn't have sugar to burn, does it burn fat instead? Is that how that works? Or I always was curious about that.
Yeah. So this is how it works. If you take in too much sugar, or if you take in processed foods and all this other stuff, and you're not using it as energy, so you're not exercising, you're not using that energy, then your body will store that as fat to use it later. Right. Gotcha. And so food. Of course, we love food and we eat food and we have this relationship, but it's meant for a purpose. It's meant for our bodies to work. This is a fact. If you don't eat nothing all day and you see people passing, they're like, oh, she needs to eat something, like she tired or whatever. When they have, we call it syncope episodes, but a lot of times you'll get tired, you feel like you're dizzy and stuff because you haven't had nothing to eat. And that's because you don't have any energy to make your brain work, to make your heart function, right? So that's not good. On the other side of that, you eating, but you're not burning off that energy. Then your body's gonna like, okay, I don't need this energy. Let me store it as fat on my belly, on my hip, whatever. Let me store it so that when I go into starvation mode, then I'll have something to draw from, right? Then that's when your body starts to kind of to pick it off. Now, one of the things about guys, guys are at increased risk for a lot of different things because, of course, when women gain weight, we get the that hourglass. Not all the time, but you got the pear shape or you got the hourglass shape. Men, they tend to gain weight on their bellies. So a lot of times, all that storing of the food, when we eat extra, it goes straight to the belly, and that circumference, that waist, that increases the risk of diabetes because now you're storing all this fat right around your organs. And when it stores it around the organs, then that increases the risk for so many different problems, not just heart disease and high blood pressure, but diabetes as well. So that activity, like you said, you was exercising during COVID, you was on that treadmill. And so other people, they were eating all day sitting at a computer, right? Remote learning. They didn't have to go back and forth. They didn't have to take the train. They didn't have to walk to their jobs. So all that activity that they used to do, they're no longer doing it. Their body is completely just storing all that extra stuff onto the body. So processed foods are a lot harder to break down. So this is the deal. If you eating foods that are not whole foods, right? You're not eating anything that come from a tree. You're not eating like a protein straight from the meat.
Right.
Your body has to process all this extra stuff. And a lot of this extra stuff is not even food. It's like chemicals. It's like a McDonald's burger. If you have that out, it's never going to go bad because it's not real food, right? Even this Impossible Burger that's not meat, it's nothing but processed food. So your body has to figure out how to digest that. And a lot of that stuff, it cannot use as energy. And so it just stores it there. It's just like, okay, I don't know what to do with this because I can't use it for energy, and it keeps it there. And then the sugar part of it stays into the system. But part of the things about eating healthy foods like apples, oranges, leafy vegetables and stuff like that, our body processes it, it puts it in the right places, it gets its nutrients, and then it puts it out. So that's why it's so much better to eat, healthier food choices as opposed to the processed stuff.
Yeah. Wow.
That makes sense.
Yeah.
Absolutely. So Dr. Gordon, I got a question for you. So we're living in an interesting time. Life itself it comes with challenges, right? And so now we're looking at COVID, and you got racial wars, tension and things going on. So just kind of thinking about the mental health, how does mental health affect physical health?
Ooh, that's a big one. So mental health so let me go back. So one of the things that I do is substance use disorders and addiction medicine. And so I try to help people who have problems with alcoholism, with like opioid use disorders and stuff like that. And one of the things about mental health, especially with this COVID, is coping mechanisms. And how do we cope when we're not feeling good, when we're feeling down, when we're feeling depressed? One, we're definitely not exercising. Two, a lot of times we emotionally eat, right? And so three, we find other sources to cope. So if I can't cope with my problems, I might go grab some alcohol. If I can't cope with my problems, that might trigger me to go use, different substances that might not be the best for me. So these things affect our health, and just the fact that we don't do the most, the way that we cope with things might not be the most healthy way to do it. And then the second thing is the stress on the body. The stress on the body itself can cause problems. It can cause high blood pressure. It can cause us to have anxiety. It can cause us to have heart attacks and strokes. I'll tell you it's been a while now, but I remember my cousin got killed years and years ago. He was shot multiple times, and his mom was so stressed out the day of Christmas. I mean, her mental health, she was gone, that she actually died. And we say she died of she died of a broken heart.
Heartbreak.
Yeah, she died of a broken heart. And I mean, it's known that different stressors can push you to the point where your body just will not function correctly. So mental health is so important. I say everybody needs therapy just to help them figure out how to cope with problems, what the triggers are, and then just healthy ways to deal with issues. So definitely mental health is tied into our physical health in so many different ways.
Wow. So how do you balance that? So I'm sure as a doctor, you get develop relationships with your clients. So when they're dealing with certain things, is there a line that's drawn of how much advice you can give them and direction they need to take, or how does that work, that relationship?
Yeah. So when I have patients and I find that there's an issue, I'm jumping in. So for instance, say somebody calls me on the phone and they're talking about they don't feel good. They mentally they're not where they need to be. They think they might hurt themselves. I'm calling the police and telling them to go to their house. You know what I mean? So that's how serious that stuff is. I'm always pushing therapy. There's different medications. I try to stop that stigma that medications aren't helpful for us, because medications work. If people have to understand that depression don't mean crazy, anxiety don't mean crazy. There's an imbalance of hormones in our brain. Serotonin's not working, and we have to get that stuff back into balance. So I'm always trying to, educate folks that it's okay to go to therapy. It's okay to take medications. It's okay to go to group, but all these things are really healthy and really vital to the mental health. And that's what's going to keep people going, because I seen people, tip over, especially with the substance use disorders. So I'm really, really diving in when it comes to mental health.
Yeah, well, I definitely want to commend you for just doing the hard work as well. Sometimes we jump in positions and we're not really connected to the people. So I just commend you for the work that you're doing and how well you're doing it. I have to. So.
Well,
we truly appreciate that.
You have froze up a little bit, Mario. No, but we definitely commend you. We want to thank you for your time and dropping these gems, so that the community can just really soak in what you've dropped and pick up what you've dropped, because I think it's extremely important that we as people of color take health more serious.
For sure.
Yes. So, men, listen, we want to encourage men all over the country that's listening to us to just take control of your health, and the families, for you to continue to teach your boys healthy habits throughout childhood. And so Chad and I are truly, truly grateful that you guys tuned in today. We pray that something that was said from us, Dr. Gordon, again, we thank you for joining us, will impact your health or someone you love's health in a positive way. So till next time, you guys take care. Be blessed.
Thank y'all.